The Student-Led Clinic project offers us the opportunity to completely transform learner placements and the way that we view them. These valuable placements become an essential resource in supporting services by targeting patient waiting lists. They have had a phenomenal effect on increasing patient safety and satisfaction, especially where we have been able to reinstate previously available services or even create new ones. And by using this model, we have seen a real success in supporting health inequalities. The model so far has been piloted with 6 students working in pairs across 3 clinic rooms with 1 supervising registered professional. This registered professional is competent and confident in managing all of the patients booked into the clinics. It's important to note that the model can easily be amended and shaped according to the specific needs of any particular profession. If you want to increase the numbers of students, you simply proportionately increase the number of registered professionals overseeing them, observing the same ratio of students to registered professionals. If you struggle with accommodation, you can extend clinic hours and stagger learner start and finish times in order to run using less rooms. This works in any specialist area that needs support and works across all professions. It's been significantly successful when piloted as a multi-professional clinic.
Clinical placements are vital in helping students develop key attributes that will enable them to successfully complete their studies, and that includes communication skills, clinical skills, and an ability to understand a patient's needs. In addition to this, placements provide learners with an insight into how to understand the need for these special assessments, being able to identify appropriate referrals, and to have the experience of working within a professional environment. Now, having the opportunity to work in an immersive practical learning environment also allows the learners to understand what is expected from them as a newly qualified registered practitioner, and it provides the opportunity to network with potential colleagues in conjunction with being able to visualise their future. At the university, we provide the learners with all the knowledge that they need to understand the profession itself, but being able to put all of this knowledge into practice with real-life patient experience is vital. Now, while our learners get experience within the university campus clinic, it's not at the same pace or intensity as you would find within, for example, the NHS. Unfortunately, as pressures continue to increase across the NHS, we have at times experienced difficulties in either securing the number of placements required for our learners or in being able to ensure that the learners have a good quality placement experience. The Student-Led Clinic project completely transforms a traditional healthcare placement by giving the learners first-hand experience of patient care. We've found that following a learner's participation in the Student-Led Clinic, not only has there been a clear increase in their confidence, but there's an obvious difference in their clinical skills, particularly when we consider communication skills and special assessment skills, which is incredible. As a result of the value of this project, we've also seen an increase in good quality placement hours, which we hope will continue to grow in order that we can provide our future workforce with all the support they need in becoming confident, qualified registered practitioners.
So being part of this project, I felt very valued. I was able to build my confidence in developing communication skills with different patients.
I've really enjoyed my placement. I felt really valued. I got to do hands-on assessment in the clinic, and my clinical skills are much better for it.
I really enjoyed taking part in this project this year. It made me feel valued and that my skills had been valued. And I think the most important thing was at no point was I made to feel like I was in the way or a burden, but more importantly, I got the opportunity to work as part of a team and feel that I'd really made an impact on patients, and the patients themselves also seemed to find it really, really interesting.
Being part of this project was really awesome. I felt really valued. Working in the NHS was such an experience. I got to see what it's like working with other professionals. As a student podiatrist, I felt helping patients to manage their health conditions through health promotions was so rewarding.
After this project, I have felt really valued and I would like to work for NHSC.
Very valued.
We've been really lucky to have podiatry clinics that have been supported by this new initiative called a student-led clinic. And what we've done is we've been able to have students come along to our clinics in a structured way to really help patients and develop their own experiences. This has been really valuable for the students and the podiatrists involved in the project. Not only have they been able to develop their leadership skills, work more closely with students, but also allow the students to take the leadership in a clinic, which doesn't normally happen. Those students who have come forward and have really supported our clinics have been fantastic. The patients have been involved with it, have been really excited to be seen by a range of students and also to be seen in a timely manner. We've had a lot of difficulties and challenges with capacity in podiatry in the last few years. And so for us, having a new project like this is really exciting. This new project has not only been helpful for the students and the staff involved, but also for us as a leadership team and a wider trust initiative. If we can be utilising the skills and development of those students and thinking about that model, we can really think about how we can work in the future. Working in the future for us is about collaboration, having close links with the universities, with the students. Taking that work forward and being able to provide quality patient care is really important to us. Those students who came forward have really enjoyed the experience. They've thought about joining the NHS and been involved in the NHS in different ways that maybe they didn't do before. So our next steps of working with the university and working with the wider services is to think about how we can embed that. So first of all, we've increased our capacity with our students, so taking on more students because we've realised that we can work differently in different ways. And secondly, to be able to look at that as an independent project going forward. By allowing students to take leadership roles to develop themselves in the NHS, not only are they helping themselves but also becoming more independent practitioners, and when they're graduated they're workforce ready and can support patients and have a lot of confidence. So in the future we really look forward to taking this project and helping patients quality care.
I had chronic pain and was worried that I would have to take time off work. I now know how to manage and improve this pain, so I'm confident that I won't need to take sick leave. I got a lot of support from attending today.
I got a lot more information than I have in an appointment before. I really enjoyed attending and I now understand the complications that my conditions can have on my feet. I would definitely attend a student clinic again.
My pain is already so much better. They had more time, so I felt really listened to, and I got so much more information than I expected. The information and advice that I need to follow is written down for me, and they even filmed me doing the exercises on my phone, so if I forget how to do them, I can watch that.
I've waited over 12 months to be seen. I was worried about my mobility getting worse, and I didn't know what to do. The students explained my condition to me, what I can do to improve things myself, and they've even referred me to the falls team through my GP, so I can feel safer at home.
I had waited a long time to come to a clinic appointment. I struggled to understand what I should do over the phone. They showed me how to manage at home so I can take some control back.
Being able to get back to running and feeling able to manage my health is my ultimate goal. After my appointment today in the student-led clinic, I feel confident that with their support and guidance, I will be able to reach that goal.
The need for growth in our healthcare workforce is well recognised and undisputed. New registrants and healthcare learners are a key part of growth. However, every additional place created by universities comes with the requirement of additional clinical hours in practice. We know that at times, securing placement opportunities for health and social care students has unfortunately become quite a challenge. For us as a service, healthcare placements are vitally important to enable us to support and nurture our future workforce, and also to ensure that we can continue to protect the future delivery of our vital services, providing a safe and good quality placement across all professions becomes paramount to service delivery. In order for us to protect the future of our workforce, it has become essential for us to consider a broader range of alternative placement settings, whether that be leadership placements, long-arm supervision placements, or a multi-professional approach working across many other professions rather than just relying on the traditional method. This is why it becomes imperative that we use new initiatives such as the student-led clinic project to enable us to continue to offer good quality care to our patients and to allow us to support health inequalities, whether that be reinstating previous services or creating new services, and in providing valuable patient education and empowerment, giving the patient the tools to be able to be part of their own treatment journey.
What we know so far following the first evaluation is that by working with this model, we can increase the number of patients seen under one registered professional by 166%. That is equivalent to an additional 120 patient appointments over a 5-day period. 100% of patients who took part in the evaluation process found value in attending the clinics. They felt more confident to manage their condition at home to avoid further deterioration, and advised that they would be happy to continue to attend a student-led clinic in the future. Pressures on existing staff are reduced by the student-led clinics, directly targeting patient waiting lists, which is supporting staff wellbeing and retention. Staff who took part as the overseeing registered practitioner enjoyed the experience, felt that it was a valuable development opportunity for them, and enjoyed being part of the learner's journey. Significant financial savings have already been made where the need for locum practitioners has been reduced. This is a low cost, low admin, but high impact project. We know that if we ask every learner across West Yorkshire to take part in just 5 days of student-led clinics a year, we have the potential to create 110,000 additional patient appointments across the region every year. But the significant success of this project is the effect it has on creating, nurturing and shaping our future workforce, whose feedback clearly shows that having this opportunity significantly increases the quality of their placement. They feel supported in increasing their confidence, their clinical skills and in making patient management decisions, while also showing them the value that they bring to our essential services.